Good morning, happy Friday, Facebook. Sorry, I accidentally hit finish before, so this is second round. Today we are doing a CO2 fractional laser, and we're going to be doing it on acne scarring. Now, this laser does do other procedures. It does can take away wrinkles, tighten skin. It's really good around the eyes, your full face, your décolleté, your neck, your mouth. This is our most invasive procedure that's in our medical spa. So anything higher than this would be in the OR. It does have some precautions. We do have to wear masks, gloves, goggles, so keep that in mind. This laser is a little loud, so we're going to try to answer and talk as many of your questions beforehand before doing the procedure. This procedure can be done on your face, neck, décolleté, like I said before. And again, if you have any questions, make sure you comment, and here we go. Laser in progress. Hi, Soch.
Hey.
How's it going?
It goes.
What are we doing today?
We are excited to do a CO2 laser today.
Ooh.
So a CO2 laser, which is right here behind me, what it is a fractionally ablative laser, and it has the deepest wavelength that's out on the market right now, which is 10,600, and it basically fractionates the laser beams, and it sends those deep into the skin, and it causes a thermal injury to the skin. And so what that is going to do is that it's going to remove old damaged tissue from the area, and in this case we are treating some acne scarring. And then what is going to happen is that the skin is going to replace that with new collagen, and it will build nice new skin for her.
Ooh, I'm excited.
Yeah, we're very excited for her. So CO2 laser. So like I said, for her today, we're using it for acne scarring. Some people that would be great candidates, people that have deep wrinkles or lines, acne scarring, any kind of scarring, maybe a surgical scar, maybe a traumatic scar, all those people would be great candidates for that.
Now, can this just be on like your face, neck, and décolleté? Can I do it on any part of my body?
So some people have more wrinkles like around the eyes, so we can do just the eyes. Sometimes we have like what we call the smoker's line around the mouth, so sometimes we'll just do the mouth. Sometimes we'll do full face and neck, or sometimes we'll do décolleté as well, if you're getting some of the deeper lines in that area. People that would not be good candidates for this, people that don't have deep wrinkles. This is not for like poikiloderma, or people that have like that reddened skin. There's other lasers for that. Actually, our PicoSure laser would be good for that. Or any telangiectasias, any venous, like little red veins. That's a different kind of laser. So this is for someone with the lines and maybe some scarring.
And this is our most invasive procedure over here.
Yes, on this side. Yep. This is, like I said, it's a fractionally ablative laser. It is not completely removing the top layer of the skin. I like to, it's kind of like when you get your grass in the summer or in the spring, when they go through with the aerator, kind of punch out those holes in your grass to allow new grass to grow. That's pretty much what we're doing here, but we're doing it with a laser. So back to who would not be a good candidate: people that are pregnant, people that don't really have the deeper lines. There's other things that we can do for that. Anybody that has issues with healing, so maybe somebody that has diabetes, maybe someone that's undergoing chemo, anyone that has issues that would slow down healing.
Mm-hmm.
So
now, there's a lot of prepping involved prior to having this. So can we explain that?
yeah, absolutely. So 4 weeks ago, we put her on a skincare program, and we customized that to her skin and to what's going on with her skin. So we went through that with her, and she's been on those products for 4 weeks now. And so when she comes in for day of treatment, so for today, we like people to come in with like a button-down shirt, because as you can see here, she's kind of goopy, and that is our topical anesthetic. So she's got some lidocaine on here, so she's been here for about an hour getting nice and numb. So we've prepared her for that. She has no jewelry on, and she's really nice and hydrated, and I think she's excited to go.
So then there is downtime with this laser, so let's go over that.
There is downtime. Another person who would not be a good candidate for this would be someone who does not want any downtime. Like Sheena said, this is the most aggressive laser that we have on this side of the medical spa. And so there is downtime associated with it. So we have here in our book, we've discussed it with her for what's going on with her. What's really nice about this laser is that we can adjust the settings. So we can tell her based on what's going on with her, based on her concerns, based on how deep her acne scars are. We've looked at our settings and we've adjusted them. And so we've talked to her and she knows she's going to have a good 4 days of downtime. So what does downtime mean? It doesn't mean you're laid up in bed and can't move. That's not what it means. It just means that we have now created a controlled thermal injury to your skin, and you need to be really careful with it. You need to baby it. So afterwards, with her, we're going to talk about our line of products here. We have our Zeo post-procedure recovery system, which is included with all of our full face CO2s, and it has all the instructions in here of what she's going to need to do. So I'm just going to go over those real quick with you because when we're doing the procedure, we're going to have a lot of noises going on and you won't hear anything I say. So one of the products we have in here that she's going to be using is going to be the Surfatrol. And she is going to be diluting this with water, and she'll put it in the fridge, and she'll be able to apply that 3 times a day. And so she'll be using this, and all the instructions are in there for that.
And now, does she do that because it helps heal, and is it hot? Like
it cools it off because again, this is creating thermal energy that's going deeper into the skin, and so when she leaves here, she's going to feel like she has a sunburn, and that's what she'll look like as well. We have these products that she'll use for that, and then also what she'll use is that she will use the Pomatrol, which is a soothing ointment, and then also the Revitatrol, which is an epidermal repair cream. And what's really nice about this Zeo kit we have is that all the instructions are on there. It tells you what to expect day by day, redness, peeling, itchiness, what day it will occur on. Usually day 2 is when we get the itchiness kind of around the jawline, kind of that tightening of the skin effect. So this tells you exactly how many times a day to use it. And
now, will she experience like peeling? Will there be blood? I mean, what type of what are we looking at?
We're doing an aggressive procedure on her today. We can do mild, moderate, or aggressive. And so we'll do aggressive, especially on her main concern area. So like on her cheeks is where she has more acne scarring, and down here on her chin. And so we'll be more aggressive there. But one of the areas we won't be as aggressive will be on her forehead and around her eye area, because that's a different type of skin, and it's delicate skin. And if you were to get your neck done or your décolleté, we would use different settings for that as well, just because of the thinness of skin in that area. Did that answer your question?
It did, a little bit, but I guess my thought was like post-recovery, is she going to be, because I've heard that like with the CO2, and this could be the old CO2 way, that people came out kind of looking like a meat, like bloody and goopy.
So back in the day, I don't know when the day was, but back in the day, we used to do, well, I didn't, but maybe Dr. Downs, because that was back in his day, because he's a lot older than me. But they used to do like a fully ablative, and so what that means is they would completely remove the entire top surface of the skin, and it worked really well. But you were, I mean, you look like a burn victim for like a good 3 months. That's a long time. That's a lot of downtime. With this laser, again, it's fractionally ablative. It's punching those beams of light down into the skin, but when it does that in a kind of a grid pattern, it's leaving healthy islands of skin around it to help heal and that new skin that's going to be growing and coming through. First, you said peeling, so she may experience some peeling afterwards. However, she's going to want to keep her face very nice and moist and hydrated, because that skin heals the best. It heals the best when we keep that nice and moisturized. We don't want it drying out, and that's what she's going to do with those products. And that's why we have just a whole list of instructions to do afterwards, because this is going to be fresh baby skin that's growing, and she's going to have to baby it. She's going to have to really take care of her newborn skin. And again, we don't want it drying out at all. And if she does get any scabs, that will come off on its own. That's your body's own natural band-aid. And when she does do the soaks with the little envelopes that I showed you, that'll just naturally come off on its own.
Cool. I'm excited to see it.
Good. All right.
So anything else?
Do you have any questions?
Nope.
Are you excited? Now, do you feel like numb? Like if you could, like you do? Okay,
Good.
That's good, because I'm
So
sure
there's
people think
different
it's
ways
hurt.
to numb somebody. Like Dr. Downs, he'll come in and he'll actually do dental blocks, like the ones you get at the dentist, that comes on pretty quickly. I mean, you're numb within 10 minutes. What I like to do is I like to do the topical, and so she did come in an hour early because she did have that time. So we avoided a needle stick and we did topical on her. So it just varies from person to person and provider to provider.
Perfect.
Okay.
Awesome.
All right.
Let's go, Sush.
Yeah, let's get started.
I gotta put my mask on and goggles.
Yeah, a couple safety things, and it's going to get loud in here. You're going to hear the machine itself. You're going to hear it firing. You'll be able to see the grid pattern on the skin that it leaves. Kat, who is an esthetician, we work together as a team. So if you see me, you see Kat. You get both of us for the price of one. Kat will be doing the smoke evacuator duties and also the chiller. I don't anticipate that she'll need the chiller. That just sends a strong beam of cold air on her face. But if she does feel she needs it, we can use that as well. But she'll be holding the smoke evacuator, and we're all going to have on our masks and our very attractive, trendy goggles.
How do I look, ladies?
Awesome.
I feel like I keep fogging my
It
glasses.
does. You have to pinch like the nose here because we're
Right there, yep.
There we go.
Do I have any goggles?
You will have eye protection.
Okay.
Yes, great question.
And so she will remove the numbing cream in sections, which makes it nice because she's still receiving that.
Perfect. All right, guys. So here we go.
Here we go.
Again, if you have comments, put them below, and we'll try to answer them. But it does get a little loud in here, and if I'm excited to watch this. So this will be our first time doing a full face CO2 on acne scarring.
And if you want that chiller, just let me know and I'll hand it to you. Okay, thank you.
And Sheena, I'll start with her left cheek. That way you can have a good viewpoint of what we're doing. Her left.
Okay, sorry.
Yeah, not your left.
That's what I do all the time.
Wait, what?
There we go. Put these here. We're going to turn
Oh.
this way.
I thought that looked nice with these curls and the goggles and fancied up. I'll have
I'm
to
going
show
to
'em.
remove this.
Oh, the
first.
cost. Good question, Stephanie. The cost for this is $3,500, and it includes all of the products. So anything you see here, the numbing, the products, that is included in the cost. That's $3,500.
And it is an aggressive treatment. So this is meant to be like a one-time treatment. Oh, you know what else I forgot to go over? How long is this going to last for?
Oh, that's a
So
good part.
this, you say, oh my gosh, that's a lot of money. Yeah, this is an aggressive treatment. One, maybe two treatments, maybe 3 to 6 months later. The results are going to last as long as you take care of it. You need to take care of that new skin and that new collagen that has formed. So that means following good post-care instructions.
Yeah.
Oh my goodness, thank you. Post-care instructions, and then applying sunscreen.
Sunscreen is so important.
Kat's going to give you your sunscreen talk.
It is. I mean, it's so important. It's kind of. I always think it's silly. She laughs at me, but it's like, if you invest in your face, your sunscreen. You know, you buy a car, you wax your car. You gotta
Here
make
comes
sure.
the eye goggle. There you go. This one right here, turn your face just
And if I get a
little.
little close, I don't need to, okay? So if you feel me? Okay. Now, is there a signal if she needs you to stop?
Yep, she can just tell us.
Okay.
Yep, and we'll do a test spot first on every section. And you can see I'm doing one section at a time. That way that numbing cream keeps numbing as we're doing the other sides. Machine is calibrating. And you can see the different, we can put different sizes, different shapes. Yeah, so we can really move it around. You can do different, all kinds of different things for different areas. So, put it back to where I want it. And the machine is calibrating, so we're waiting for that. There we go. Alright, we're going to do a test spot first, okay? And I'm just going to start right here, okay? You're going to tell me how it feels. Okay, ready? 1, 2, 3. How was that?
Fine.
You did okay? Okay, very good. We're going to go ahead and get started now. Can you see that grid pattern,
Yep.
Shayna?
Yep, we sure can.
So those are those little beams of light that are going in, and you can see the islands of skin that are left behind that will assist with healing. There's also some collateral energy that the machine produces, so that'll help with collagen formation as well.
Her eyes so fell off.
Okay, we'll go to the left a little bit for me.
Yep, see all the grids, you guys? Now, how, like, will this will be like that's supposed to take almost a couple weeks for her to see the result, correct, Sophie?
Yeah, and because collagen takes 3 to 6 months to form, so it'll just increase as time goes on. But on some of the more shallow acne scars, I would hope to see even better improvement faster.
Now, how long will these grids be here?
Will the what?
These little grid marks. How like, when will they'll kind of go away?
They'll kind of scab and fall off on their own, but it'll be like a wet scab.
Got it.
How are you doing?
Doing all right.
Can you guys comment if you have any questions or want to know anything, or if you want to see a different procedure? Talk to me.
You doing okay? Okay.
So cool.
Looks good.
You can kind of see her skin retract.
Yeah, can you see her skin plump up in some areas? Okay. I'm going to do a second pass. Turning my laser a little bit. So what are you feeling?
Kind of feels like little brushes.
Little brushes, okay. Are you feeling any pain at all?
Slightly.
Okay. What would it be like on a scale of 1 to 10?
Right now, probably like maybe a 3 or 4.
Yeah, pretty good for a second pass.
Yeah.
Yeah, so we're doing a second pass now, a little more intense. And I switched around my laser like the way it's pointing. Just so that our grid pattern's a little bit different. So can you see the difference in the grid pattern like here versus here?
For sure.
Great. And I'm going up to here because for the eye area, I'm going to be doing lighter settings. Still a good treatment, but different for that area.
So Virginia wants to know what's the downtime.
Well, it's going to depend on the settings.
So if it's more of an aggressive treatment,
Right.
You're thinking like 4 days?
Yeah.
Sound about right?
Yep.
Around 4 days. So if you have this procedure done on a Friday, you can definitely go back to work. That's not on a Monday. That's not, you're just going to be a little red and
Looks really good.
look like you have a sunburn, Virginia.
Really good.
And if you didn't hear me because of my mask, Virginia, just let me know.
We're moving on your chin now. So I'm taking the lidocaine off here.
Looks so good. I just think how cool, like, look at, like, the difference of the color.
Yeah.
That's amazing.
Yeah.
And it'll get kind of pebbly and kind of like off, and then she'll have fresh baby.
It'll feel a little sandpapery tomorrow. And she's actually going to take pictures every day for us. So we'll, so for the next 2 weeks, she's going to send us a picture every day. So we'll have to do a follow-up with her. All right, I'm going to go right here. You doing okay?
Mm-hmm.
Okay. Just looking at the tissue response. Good.
Yeah, our viewers are climbing. You're popular, so
I'm going to actually change my size here. I'm going to get in right here. So I just wanted to show you how I can get into different areas with a different size or different shape. See that?
Yep.
So that's kind of cool. Maybe I just think it's cool.
So
What's your question?
I see there's like almost like, I don't know if that's like right here.
What's your question?
And right, like in that area right there. Yeah.
Yeah.
What is that?
That's a little bit of, I don't know what that was.
Maybe just product.
Yeah, might have been a little bit of product.
I
But
was
you
like-
can see there's really not a lot of bleeding. We might have
Yeah.
some pinpoint
It's normal to
bleeding.
get something.
But,
yeah.
I mean, you're not going to leave like a bloody mess from here, so.
Trust me, you're looking good, sister.
Yeah. All right. I'm gonna move on to her.
Sorry, I was
Okay.
like, what is that? Here's a little product.
This here. Do her eye area. So it's kind of a messy procedure as far as removing the lidocaine.
And once she starts those soaps, you won't see so much that grid pattern.
Okay. And will she start those soaps like right away after she leaves here to go home and then go ahead and
Yes.
soak?
Yep.
Okay.
And it's really nice because you can put them like in the fridge and they'll be nice and cool. Because this will feel like a sunburn.
We'll have her ice. We'll have her sleep maybe tonight with her head elevated. A couple pillows.
Yes.
Now, do they take any type of antibiotics or?
No, you just got to remember that this skin is new skin. We call it the thermal injury, so you just have to, wash your hands before you deal with your skin. I'm going to adjust my settings for her eye area.
Everybody kind of see like a look here, and then here. Sweet. Very cool.
Just waiting on my
So this procedure usually takes about an hour or so, and then also an hour with the numbing. So you're going to be here for around 2 hours, 2 hours and probably 15 after your ice pack and that kind of stuff. So it is a little time consuming, and when you have this procedure done, you definitely need to take off work or be prepared to kind of go home, maybe, veg out for the weekend, and then you'll be ready to go.
So she usually likes to see like in a week and then in a month too.
So I like to call them the next day and just see how their night went. And then I see them back in a week, and then a month, and then 3 months, and then 6 months. And we take Vizia photos all throughout this, so we can see not
progress.
only on the surface how you're doing, but deep down into your dermis how you're doing. How are you doing?
Doing good.
Okay, we're gonna go ahead and start with the eye area. Here we go. How you doing? Okay.
And you guys can see the spot size is different there.
Yeah, and then also what I like to do for this area is I like to get really nice and close as I can on here.
Ah, because you need it to be beautified.
Kat, can you pull her cheek down just a little bit? There you go. Here comes this. So this is a different kind of eye shield, and actually I'm going to show you. It is approved for our lasers, so for this wavelength. Okay, you can let go, Kat.
Kind of looks like it all that.
There,
right
see,
there.
so then I can
Yeah.
get under that a little bit better. So I like to do that. All right, and I can get more surface area.
Here we go.
All right, you ready? 1, 2, 3. How you doing?
Good.
Okay. Let's change my shape actually. There we go. And I'm gonna change my size. Okay. Can you see her larger pores here? Shane, I don't know if you can see
Yeah.
that, but this is perfect for that. So that'll really help plump up these pores. Also, something else I want to show you is, I don't know if you can tell, maybe you can. These grid marks are different than
Yeah.
these down here because it's a
Yeah.
different setting for the eye area. So it's nice that we can customize that. Yeah.
Definitely can tell.
And then I want to get even closer there, so I'm going to make this even smaller. So I can get right in here. How is that?
Good.
Okay, very good.
A lot of options with this.
Yeah, there are a lot of options.
And again, you guys, this isn't just for acne scarring. It's for deep wrinkles. It can help tighten your skin, resurface your skin. So, I mean, if you used to be maybe like an avid tanner or tanning bed and you really, you know, I've seen a lot of aging, this is a great procedure for you. And it's kind of like a one-stop shop. You know what I mean? You do this procedure once, and it's not multiple times, which is nice.
Yeah. There are some people that don't want the downtime and they might come in for multiple sessions. We can do that too. It's just, you just need to understand, you know, the deeper the treatment, the better the results. So.
That looks great.
Sorry, I'm a bit of a perfectionist.
Hey, that's not a bad
I
thing.
just want to make
No,
sure I
it's
really
not.
You like to hear that?
good result here. It just takes me a little longer because I want to make sure I got everything. How are you doing?
Doing good.
Still okay?
Mm-hmm.
Okay. Pain
No.
at all? Any pain?
Not really, no.
Okay, good.
Now, will this help with like brown spots? you
Okay,
know,
so it's
uneven
not,
skin?
we cannot technically say it's for brown spots. However, based on the depth of that pigment, because it is ablative, it might lift that up and kind of scab and flake away. We can't promise that. That's something more a Pico would do, but we do see that a lot as well.
Which is this bad boy over here.
Yeah, and a lot of people do this and then they do maintenance with the Pico.
Yeah. Why, Kat?
For pigment, for
Pigment.
skin rejuvenation,
Exactly.
creating more collagen.
Kat always likes to say, you bought the car, now you gotta wax it.
You gotta wax it, you gotta
take
take
care
care
of
of.
it to maintain your results.
And with the Pico, there's really no downtime.
Right.
Okay. That looks pretty good.
I mean, you can already like look at here, you guys, and then look at here.
Yeah, I'm gonna actually hit that one again, just because she has a pretty deep scar here. So I would like to plump up that skin a little bit more. So there are some areas where she might be just a little bit more scabby here when she's healing, and it's because I went over it again. Just because she has a little bit of deeper injury there, deeper scar. Because that's what acne is, it's a scar that leaves behind.
So cool. So I'm gonna just do really quickly. Here's the side.
Sorry.
You scared me, cat.
Here's this guy, you guys. So you can see over here.
Yeah, I'm gonna do this right here. And then I think I'll change my settings and go to my other side.
Perfect. All right, I'm gonna step out so you guys can finish.
Does it feel tight? A little bit?
A little bit.
All right, so I think that's all. We're gonna let them finish this procedure, and we'll keep you tuned with her results.
Yeah.
Good.
Okay, cool. Bye, guys.
Thank you.
Toodles.
Bye.
Whew, okay. What a day over at the Center Yourself Medical Spa. Again, if this is a procedure that you're interested in, it is $3,500. It includes your products. It does have some downtime depending on your settings. So she talked about that. It can have a very aggressive treatment or up to more of a lighter where you might have to do a couple of different sessions. You do have to be on products about 4 weeks prior to this procedure. And then again, then afterwards, we have a post-recovery kit for you, which she showed earlier. Includes some soaks to help you feel kind of red, sunburnish. You get a little scabbing, but I can't wait to see her result. I think it's going to be fabulous. Today we did it on acne scarring. However, it can use wrinkles. Maybe you have like old leather tan skin from that tanning bed that you want to kind of repair. Any type of surgical scarring at all. Good for the face, neck, décolleté. So when we mean décolleté, that's kind of this chest area right here. But that's pretty much it today. This is our most aggressive treatment. Again, it's $3,500. And if this is something you're interested in doing, give us a call. Sochi and Dr. Downs can perform this treatment with the assistance of an esthetician. However, you do have to have an RN or above licensed for this procedure. A couple things coming up. Next Tuesday, we have our BioT. We have a 3 o'clock and a 5:30. If you're interested in the pelleting, this is a great time to come to that. And then Spring Fling registration will be opening up March 1st, so get excited. Woo! But other than that, that's all we have this week. We hope you guys have a great weekend, and it's supposed to be beautiful out, so take lots of walks, enjoy it, and we'll see you back next Friday. Bye, guys.